So great question, complex question, and one that we still don't have a great answer for, whether you're looking at why do some kids get environmental allergies or why do some kids get food allergies. There's actually a birth cohort study that's happening now that is trying to give us some answers to these questions. And what everybody always wants to know is, why does my child get this, or why does one of my children get this, but the others does not? Because right now we don't have a great answer for why do some people um, do and some people don't. Yeah, another good question, and one that we have been getting a lot over the past few years. So, the global warming is definitely contributing to higher temperatures and longer seasons, and that combination, one is leading to increased pollen production. So, basically, there may be more pollen in the air, and then longer seasons. So, the season may start earlier and may also last longer. And so, when you're thinking about management of this, it may change, when you need to think about starting your allergy meds, knowing that the season again may start earlier than it had historically and may last even longer. So you may start your allergy meds on sooner than you may have 10 years ago, for example. And then kind of with a lot of the guidance, otherwise, not too much we can do with the counts, despite the other things we would do with medication and avoidance measures. Great. So trees are definitely our big one for springtime, and kind of where you are regionally may impact which variety of tree that is, but tree is our biggest culprit. So all of the beautiful flowering trees, although they're lovely, they are what's contributing to the allergy symptoms that we see. Yeah, so it can both be which plant types live in your region, and so if you're somewhere that the plant types are different, then your main triggers will be different depending on what's in your area, and then can also see some regional differences. For example, like time of year. So our summer is different than summer in Australia. So just influencing when things may be in bloom depending on where you are geographically. Yes, I unfortunately have the overlap of both right now myself. And there can definitely be some similarities. So you can get the nasal symptoms, runny nose, stuffy nose with both. More commonly for eye symptoms, as far as like itchy, watery, red eyes, you can have some of that with a viral infection, but that real itchiness is much more common to be seen due to allergies. And um, some other things can be fever. So fever is not going to be because of allergies and would definitely make you think more that that's infection related. And then also, do you notice that symptoms seem to flare or only occur like when you go outside or if you've been spending the day outside? So that exposure relationship would also make you think more about this is due to environmental allergies as opposed to infection. And then in pediatrics, some of what we think about is like age of the child. And so for the outdoor allergens, you often have to be alive for a couple seasons to become allergic to those. So if I have a 2 month old who has a stuffy nose, the most common reason for that would be more likely to be a virus as opposed to if you have an older kid who having environmental allergies would be a much more real possibility. Yeah, so I think definitely preferences of the family being a big role. Many of these medications are over the counter, but that being said, it can be pretty overwhelming sometimes to walk to the allergy aisle and see all of your different choices and understand what dose is appropriate for your child and kind of which combination is appropriate. And so the allergist is very happy to help with that. And then So I think kind of thinking of like when does a referral make sense? So I think thinking one, does the story fit that this is seasonal allergies? You know, you have a kid, they have these in the spring, they take a antihistamine and symptoms get better. Um, and they're managed with kind of minimal treatments, then that is probably fine for their pediatrician to help manage if the family feels comfortable with that. For some, you know, they're trying kind of first step, second step, maybe even beyond that of your typical over-the-counter allergy medicines and still not finding relief, or still understandably, you know, it can be very helpful to actually pinpoint, which is what allergy testing can help us of what do we think you're allergic to, and then the allergist can help guide you in more depth on how can we possibly decrease your exposures to those allergens when possible, and also just help know kind of your question earlier of what's infection versus what's allergy, of kind of helping pinpoint what might be your worst seasons. And so if you have symptoms, do we think that's allergy related? And when might it be helpful to start medicines for your child during the year? And how long should you continue them? Would all be things an allergist could help with. Definitely a problem that allergists are well trained to help with. And a kind of common thing we see with these medicines is sometimes there's confusion on which ones can be used as needed and which ones need to be taken on a more regular basis in order to see benefit. And so if anyone has questions on either how to use these medicines or which combinations are safe, to definitely check in with their pediatrician or their allergist.